Hi, my name is Dr. Aparna from Meditest. We are partnering with Ponea, and today we shall be discussing about home lab testing. Who is a phlebotomist? So this is a healthcare personnel or worker who usually draws venous bloods from patients for either samples or donation. Now, they are usually governed by a board, or they're given a license by the Kenya Medical Laboratory Technician and Technologist Board. What are the common lab tests that can be carried out at home? So some of the common lab tests that can be carried out at home are any blood samples, urine samples, or stool samples. 90% of pathology tests are usually carried out from blood samples, which usually can be done from the comfort of your house. And now some of the panels which are done under this are like liver tests, whole liver profile, kidney profile, tumor markers, metabolic profile, vitamins, and various others. A common and a new test added to this panel is doing the COVID test also from home. The only procedures which we do not do from home are those procedures which are a bit invasive, and that is like a pap smear, whereby it will be done in the facility and not from the comfort of your house. So another question asked usually is, how is safety guaranteed while the home collection will be done, or the sample, will it be done in a sterile way, or will it be transported properly from my house to the facility? So usually how we do this is this. The phlebotomist usually double masks, wears a face shield and also double gloves, does the collection in a very sterile way, and usually now for COVID testing or any other patient who we suspect to have COVID, the personnel also does an extra wearing of the suit, which is the personal protective suit. That is how collection will be done. Transportation to the facility is usually done in carrier bags, and it will be done in two ways. One of the ways done is using in room temperature, or the other way used is doing it in 2 to 8 degrees by use of ice packs, and that is how they are being transported to the lab. Once it's received in the lab, it's going to now undergo the process of how it will be stored in the lab and run in the machines like centrifuging and all that. And also it will be registered into our systems that we have received it and what time we have received it. A common question asked is usually, how do I get my results after doing the test? Usually all the machines are integrated, and there's a bidirectional way of integrating, there's a bidirectional interfacing done. So once the patient has registered their results and usually specified a doctor's name, the patient gets the results first, and also the doctor will get an auto email from the results. The doctor will get also the auto email because you have registered it under a specific doctor. In case you have not registered a specific doctor, you have just put it as self, then in this case only the patient gets the results and you will take it to your doctor. That's how the results are gotten. Another part of this question usually is, once I've gotten my results, do I get my results interpreted? This usually happens when a patient does not have a doctor, or they just want maybe the interpretation of their results and they do not want to go back to their doctor. So usually what will happen is this: if you would like to see a doctor from our facility, yes, the doctor will interpret for you the results. But if your doctor was from another facility who referred you to our facility to do the tests, or you put it as self, then no, because at no point do we break the patient-doctor confidentiality in between the chain. So therefore you will take back your results to your doctor and they will help you interpret the results and give you the way forward for this. What are the benefits of home lab testing? The benefits of home lab testing, why would I go for this? One thing is it's efficient. It does not waste my time. I do not have to go to a place. It's usually the people from a specific lab are coming to do for me the tests. One more thing is it's convenient, whereby I do not really need to go to the facility. It's saving on my time. I can continue with my day's work. Another thing is usually that it is reducing exposure, especially at this time where you do not want to get extra exposure. You're not queuing in any lines, you're not wasting time, and so the people will come to you at the specific time you would like to do it, and they'll just come and pick up the samples. And one last thing is that there is no extra hidden cost for home collection. So therefore, you can just get it done from the comfort of your house or your office in case you need the collection done. Thank you for joining us in this discussion. You can book my services through ponea.com, and I look forward to having you further in other discussions.